evening. How are you?
All good.
Good.
How are you?
I am good. What's the good news?
Thank you. So, before your message, just around 15, 20 minutes before that, I received good news. And the consultant called and he has given me a message that you have been selected for consultant post. Update your TPD that you got a job and get your.
Congratulations.
Thank you very much. And get the remaining workplace-based assessment completed as early as possible.
Great. Congratulations. How does it feel?
Yeah, it was nerve-wracking. There was one after other questions, but the thing that well, after having a couple of practice session with you, that I remained calm and focus on each aspects, including clinical skills that I was missing, and then coming to academic step by step, and then the research and the teaching, then proper the management skills, and then personal. Then there were multiple management questions, service improvement questions, conflict resolution questions, junior doctor in difficulty question was there. Then busy department.
Okay.
That one was
Right up
the
your alley.
yeah.
Didn't we do all of these in our one-to-one sessions?
Well, I think we have done all.
Yeah.
And in addition to that, then they focus on the point of care ultrasound, how you can
Uh-huh.
improve the department, and the what are your thoughts in workforce retaining?
Retaining.
How can you help in that one? Then I told my thoughts personally by increasing the post with a special interest, like point of care ultrasound, like resuscitation fellow, in addition with ITU plus ED combined job, then the acute medicine fellowship job, along with acute medicine plus A&E, though, so that it will improve the skills. We can use skill mix in the emergency department to improve flow and decision making and improving the flow. They were very happy with this answer, particularly. Then another aspects they were focusing on the point of care ultrasound, how I'm going to help them on the shop floor.
That's what
And
I kept telling you, didn't I? Focus, focus, focus.
focus.
Well done.
The same question again they asked regarding how will you address the training needs, teaching needs in a busy department. So I thought this is all these questions that we prepared with you, I prepared with you, they asked the similar questions.
Good. So, what was your thought about when? Uh, I hope you don't mind me saying you told me that you have had few bad experience. You didn't get the job. You went for interview. What was different this time?
This time there was hardly any question where I mumbled. Yes, there was a couple of questions where there was not a problem with the thought process, but the dial-up delivery, because of one after other question was there, and my tongue was gone dry. So I have to take water uh, to keep my tongue wet and keep talking. Then
Yeah.
I control my nerves, slow down, and for a while, like we do in 5 second pause to reduce 10 minutes. So like that, I just pause and
You mean 10-second pause,
restarted.
not 10 minutes.
So 10 second pause
Yeah.
or 10 minutes to reduce down 10 minutes. Basically, this fundamental we use in European trauma course. Take a
Okay.
pause 5 seconds so that you will save
Okay.
going
5-second
wrong.
pause for 10 minutes. Yeah. Yeah. Yeah.
So you save the 10 minutes rather than going wrong.
Yeah.
So
Yeah.
take what you have to do. Then there's a similar thing that I took a pause and then again I gather my thought process, reorganize my sentences, and then again service development, patient-centered care, staff development, improving the experience of the patients, maintaining flow, clinical skills, non-clinical skills. So all step by
All
step.
went well. And what you're saying is that somewhere along the interview, you suddenly realize you need something is not right. You paused and restarted again without having like any bad, feeling that things are going bad.
Yeah.
You were able to control everything when things happen at such a fast pace.
Yeah.
Okay. So what was
On
it that, yeah,
on my first question, I got a positive vibes from
yeah,
the consultant team and the interview panel, that they were impressed with all the clinical experience plus the specifically point of care ultrasound. Again, they asked one thing there that I forgot, experience about the SOE, serious untoward incident management.
yeah.
So that one was also a good feedback. The
The
same thing, reflection for
the
myself
CV
and the training.
questions is very important. The first few minutes are really important. They make or break the interview. And if they usually make up their mind, I mean, they have make up their mind with the pre-interview visits and experience and everything. But first few minutes are very crucial. You nail it. You did well. So how do you think the career for doctor, when you had the mock interviews with us, how did that help you? What changed between your previous interviews and this interview?
I think with this interview, I can say I was more organized, and for every aspects, I have had proper thought processes to continue my talking meaningful way, rather than just mumbling here and there, bringing up unnecessary steps and repeating the steps. I was in a proper flow step by step, in a cool and composed way. I think I was, this is the time where I was well organized, in a proper flow, and with multiple integrated thoughts with each other. So I think this is the outcome of the practice and the mock interview that I have had, and my self preparation through the notes and all. But the most important thing is a practice. If we will not practice, you will not about, or you will not be able to bring thought, and we will not be able to correct my if you will not practice. I think the most important you think that you addressed regarding the clinical skills and point of care ultrasound and 2D echocardiography. I think that is the thing that win the situation.
I think it was because, as I said on day one, is that you had the knowledge. You knew what you wanted to say. You had your CV was so full of so many things you could offer, but you were not selling them. You were not using them to your advantage. And the minute that things happened, everything clicked in right place. So, one last thing: what would you say to anyone preparing for consultant interview, apart from use us?
To have an advice for those who are preparing, I would like to advise them to have practice, have homework for themselves first, and then have mock interview practices that will guide them to organize their thoughts in a proper systematic way, and that will lead to them, rather than mumbling and stuck in between the answer, in a proper way to impress the panel.
Well, with that, I would say thank you very much. Congratulations again. Time to celebrate. So, a house move, and lots of things to happen in next year.
Yeah.
So, lot on your plate. I will leave you to enjoy, and congratulations again.
Thank
Well
you very
done.
much for your help. Thank you.
Thank you.
Thank
Bye.
you. Bye bye. Bye.
And that was Bilal, who improved significantly from just few hours of one-to-one session. I think it was 3 or 4 hours. He couldn't use all his hours because of work commitment, but practice makes a huge difference.